Dear Expert Commission, the present research paper is devoted to the topic possibilities of prognosing liver fibrosis in children with chronic hepatitis. So let's get closer to our subject. The development of liver fibrosis in children is an urgent problem in modern hepatology. This pathology occurs in children against the background of chronic liver diseases such as chronic viral hepatitis B and C, autoimmune diseases, and inherited diseases. The golden standard for determining the stage of fibrosis cirrhosis by the Metaview scale is liver biopsy, but this procedure has limitations and increases risk of complications. Let's talk about our research purpose. So our research is aimed at assessing the risk of fibrosis development in children with chronic hepatitis by means of non-invasive diagnostic methods. In our research, we used assessment indices. So there are APRI index, fibrosis 4 index, and especially diabetes ratio. Materials and methods. So the observation group included 33 children aged 6 months to 17 years who visited the clinical diagnostic department in Krasnodar. On this slide, you can see the distribution of patients that was performed in accordance with nosological forms. So there are HCV, HBC, and hepatitis of unspecified nosological forms, unspecified etiology. Here you can see APRI index and all the calculations we made to calculate it. So if the index is more than 1, it means high risk of significant liver fibrosis development. And on the other hand, if index is less than 0.5, it means low risk of fibrosis development. Fibrosis 4 index, if this index is less than 1.45, it means a lack of fibrosis risk. And if fibrosis 4 is more than 3.25, it equals high risk of significant liver fibrosis. And continue the diabetes ratio. Normal range is from 0.91 to 1.75. If ratio is more than 1, it means significant damage. And if ratio is less than 1, it means no high risk of fibrosis. So let's talk about our results. Average index values are APRI equals 0.6 and fibrosis 4 equals 0.2. All patients have APRI less than 1.5 and fibrosis 4 less than 1.3, indicating low liver fibrosis activity. Calculation of diabetes ratio demonstrates that 2 patients, which means 6% of all of them, have a high probability of developing fibrosis, ratio more than 1.33. To sum up what we just said, let's move to conclusions. So comparison of liver fibrosis index calculation in children with chronic diseases revealed similar results for APRI and fibrosis 4 indices. Both methods take into account not only ALT and AST levels, but also platelet count, thus increasing informational value, while diabetes ratio has lower specificity. All of the above mentioned indices can be used as a practical screening method. They are easy to use, cost-effective, and easy to calculate with statistical software. Thank you for your attention.